want to talk a little bit about your field, and specifically, can you talk about the challenges behind the expected shortages in the medical laboratory field?
Yeah, this is a topic that I know you and I have talked about before, and it's ongoing, John. I mean, it started before the pandemic. So we're talking specifically about medical laboratory scientists. These are the individuals that conduct about 14 billion laboratory tests annually every year in the United States. Those 14, and that's probably an underestimation because of some of the testing that might be more rapid testing or things like that. But at least that number. And those tests provide about 2/3 of all data for all medical decisions to physicians and to other healthcare professionals, really from cradle to grave, right? So our professionals are critical. We are often not thought of in direct patient care because we're in that laboratory-based diagnostic detective type of arena, which is amazing. It's a great college major. It's a great professional career track. But we're not in that, we're not sitting there at the patient bed where people see us and the family see us. But you absolutely have to understand that without us, that physician, that nurse, that pharmacist, they really don't have the data to rely on at that point to make a diagnosis or to pick a drug or even to predict a surgical technique. So really important. We often, one of the things I like to tell people is that we're the mechanics and the ground crew for that airplane you're getting on. You don't think about us every day, but by God, you better hope they're practicing well and they're alert and they're doing their job well when you climb onto that airplane. I mean, obviously the pilots, the doctors, the flight attendants, the doctors and the nurses are there and you see them and they're so important, right? I mean, we love all the healthcare team, but don't forget there is a ton of people on the ground and the air control tower and elsewhere to do all those tests to get you ready for your surgery, for your drug, for your procedure.
Absolutely. And of course, you're a professor at Texas State. Can you provide an overview of your program at the university for medical laboratory professionals?
Yeah, I would love to. Very proud of our program. It's existed since 1974, and it's kind of evolved over the years. Currently, we take 20 students each year. They start in the fall. And really, it's called a 2+2 program. So many healthcare programs are like this, including nursing and others, respiratory care, for example. You do all your ground first 2 years of kind of general education and prerequisites in the basic sciences and chemistry and math and so forth. And then you apply to our program. So it's competitive, much like any of the other healthcare programs. And so we take 20 a year and we have 20 juniors and 20 seniors. So we have about 40 or so majors each year. And in that senior year, so they're doing all the typical foundational coursework. I often tell people, if you like diagnostics, if you like figuring out really interesting patient problems, if you like working with your hands and doing some really cool stuff with technology and automation and doing microscopy and blood banking and hematology. I mean, it's just really interesting. Clinical chemistry. Our majors really like 4-in-1: clinical chemistry, blood banking, clinical microbiology, and hematology. And then on top of all that, John, we're the professionals that make sure that all the quality control, all of the validation, all the really behind the scenes necessary regulatory things are going right in the hospital laboratory. And that's why we are certified or licensed professionals. It's not just anyone can do these types of jobs. It takes a lot of critical thinking. We do more laboratory medicine coursework than anyone, including physicians. So that this is our wheelhouse. This is what we do. This is what we're educated and trained to do. And in that last year, one of the awesomest things about our programs around the country, including mine, is those students get to leave and do blocks of rotations in hospital labs or public health labs, which is a great career path, or in specialty labs like molecular labs and things like that. So they pick up hands-on mentoring, working in the trenches, and they do that spring and summer alongside courses in their final year. And when they graduate in August, different programs graduate at different times. Ours graduate in early August. We have 100% employment rates. We have 100% completion rates. Once you get into the program, you typically finish, and we approach the high 90s, mid 90s, our credential exam pass rates. And so we provide a vital workforce for Central Texas and beyond. Many of our students go and get graduate degrees, and they end up in different states or different places. And while 80 to 90% of them are in hospital laboratories, many of them do, handfuls of them do end up becoming pathologists, physician assistants, physicians, pharmacists. We've had many that go get a PhD or a master's in some core biological area, and they end up becoming a regulator, or they move into industry. So it is a broad, really good foundational degree. We want you to stay in the hospital laboratories because we do need you. We have really big shortages in this country, but it's also a foundational degree to launch you into infection prevention, or into public health, or to medical school, or to pathology, or whatever kind of area you're headed to. So I can't say enough about it. It is a wonderful degree. It's rigorous. We build a family because you're in a small cohort, 20, 30 people, and you go through everything together. So if you like that, if you find that you are a high school kid or an early college student, and you're thinking, ooh, I don't really know if I want to be in direct patient care. I don't really like dealing with sick people every day. And I'm not saying that to be funny, but it's true. Some people just don't want to be right in the face of sick people all the time. Maybe you can't handle some of that life death stuff in the moment, or maybe you just don't find that you like that type of experience. If you like being a detective, if you like being a scientist, if you like coming up with answers to complex problems, then the medical laboratory is a wonderful choice. And remember to look medical laboratory as a major. Many people, this is my latest crusade. Many high school students and early college think biology, which is fine, or they think chemistry, or they think pre-med, but you need to be looking for medical laboratory or clinical laboratory. Medical laboratory is the current nomenclature that we're going forward with. So choose that major so you can get in our sites early, and we can make sure you're getting the right prereqs and other things lined up.
Yeah, and you really laid out some candidates, or what people are looking for, who might be good candidates for getting into the program.
Right.
And about it as far as that. For those who might be interested, what are the best resources or guides to access more information?
Yeah, so there's some wonderful resources. I'm going to start with our professional organizations. There are easy to find by Googling or going to websites. The American Society for Clinical Laboratory Science, ASCLS. You can go to the American Society for Clinical Pathology, ASCP. Those are two biggies that you can get multiple resources from. There are, there are papers you can read. There are articles you can read. There are video and podcasts out there. Many like the ones we're talking about right now with Contagion, that do a great job of getting that word out there. Today's student, I think, is looking at digital-based programming, podcasts. They're online, they're on social media, so we do a lot of that. And there are key leaders out there and key organizations to do so. So that's the big picture, kind of the big net to look for things. But don't be afraid if you're a high school kid, or a college kid, or even someone older that's looking to change your career path. It never hurts to go into a university website and drill down to a medical laboratory science program. So if you're in Texas, we have 13 bachelor's level programs, including the one here at Texas State. And we have everything you need on our website, including all of this stuff I just talked about. But you can find out about curriculum, and you can find out about completion rates and pass rates, and what our alumni are doing, and finding other cool links to kind of learn those types of information. But all of it, all of the above. And then, feel free to talk to a professional. I always recommend, set up a tour. If you're a high school teacher, call the hospital and see if you can bring some of your students in for a tour, so that they can experience the medical laboratory and not just all of the other patient hands-on types of majors, because we need you we need some of your students to look at the medical laboratory and some of these other career paths.